We're a specialty unit. We primarily take care of bone marrow and stem cell transplant patients. We're a 36-bed unit, primarily adult patients, and I always say a sprinkle of pediatric patients. We do have kids on our unit, and that was part of the COVID reshuffle, so we don't know how long those kids will be with us. Our nursing staff does take care of kids ages 10 and older. The younger kids, the pediatric nurses do come over to our unit to take care of those kids. We are a mixed level of care unit. We have acute care, progressive care, and step down critical care patients. The large majority of our patients are going to fall under that acute care realm. We are primarily a medical oncology unit. We give the most chemotherapy in the organization, other than the outpatient infusion center. So all of our nurses become chemotherapy and biotherapy certified within their first year. All of our nurses, I always like to point out, a lot of times when people hear transplant, they think these patients go to the operating rooms. The bone marrow and stem cell transplant is a nursing procedure. The nurses do those procedures at the bedside. All of our nurses receive the training and education to be able to do those transplants. Do you want me to talk about ratios or anything? Or
that would be great. Please add ratios. That's always interesting.
So patient ratios for our nurses on the day shift, they take 3 to 4 patients depending upon acuity and level of care. Night shift, our nurses take 4 to 5 patients, again, depending on acuity and level of care. If there's a step down critical care patient, that nurse will not have that patient in a 5-some on the night shift. We see our main medical team is the adult bone marrow transplant team. Then the other part of our patient population are our general oncology patients, or our patients with solid tumors like liver, lung, breast, colorectal, pancreatic. A positive for the nursing staff is we primarily work with 2 main medical teams. Both services are here 24/7. The diseases, when I talk about blood and marrow transplant that we're seeing and treating, are our blood cancers or our blood disorders. So we have lots of leukemia and lymphoma and multiple myeloma patients. Average length of stay is a lot longer, 1 to 2 weeks, upwards of a month, sometimes more. So truly having the ability to build relationships with the patients that you're taking care of.
Missy, thank you. We'll go to Brandy Johansson for 5 West. So Brandy, tell us a little bit about 5 West and what makes this unit unique.
Thanks, guys. Yeah, thanks, Renee. I'm Brandy Johansson. I'm the nursing manager for 5 West. So definitely a different and unique opportunity on 5 West because for the past 11 months, my unit has been a COVID unit. So we switched to a COVID unit last March. And fortunately, last week, we were actually able to switch back to a medical surgical telemetry unit. So I'll talk a little bit about both. So the neat thing, like I said, about 5 West is you have to have a lot of flexibility, a lot of adaptability, and just be able to go with the flow of things every day because you never know what's going to be thrown at you. Like I said, fortunately, our COVID numbers have decreased enough that we were able to switch back. So I'll talk a little bit about the COVID side, then a little bit about the med surg side. So the COVID side, we are the medical surgical adult side of COVID. With COVID, these patients are really sick. So on our med surg side, some of our patients are actually a little bit progressive level of care patients. Lots of high oxygen demands, very, very sick, and they get very sick very quickly. So obviously with the COVID side, we also have the PPE demands that you have to do. So all the donning and doffing of the PPE that is required to care for the COVID patients. So with that, we have decreased our ratios on the med surg side with the COVID patients. So they're about 1 to 3 for both days and nights, sometimes 1 to 4 on nights. But we have, like I said, tried to keep those ratios low because of the amount of PPE that our staff do have to wear. One thing that we're extremely proud of on the COVID side is that we have not had one healthcare provider contract COVID from a COVID patient. And like I said, we've been doing this for 11 months. So that's pretty spectacular. We're one of the few hospitals in the country that still have that statistic. And like I said, we're extremely proud of that. And that's just our staff holding each other accountable and trying to keep each other as safe as possible. Like I said, it's a great opportunity because with COVID, it doesn't care who you are. So you could have a trauma patient, a stroke patient, a patient that had a heart attack, someone with pneumonia, any of those things. It's all kinds of adult patients with COVID. So that's the COVID side of things. So back to the med-surg side of things, which our staff are very excited to be back taking care of med-surg patients. So we're very much a general medicine med-surg unit, just like Meg talked about. So we see all types of med-surg patients. So, CHF, pneumonia. We have a few car accidents here and there. We do take care of a few cancer patients every now and then if they, some overflow from those units. Just all sorts of types of med-surg patients. We do have two specialties though that we do have on 5 West, one being the cystic fibrosis population and the other being the bariatric surgical population. We were super excited because we got our first patients from those groups today. And so our staff were very excited to see our patients that we've worked so hard to take care of in the past with. So very, very exciting stuff for our team. But like I said, the reality is that we may have to switch back to a COVID unit at any time. So like I said, with 5 West, you do get a little bit of everything really on our unit, which like I said, our staff have grown a ton. You have a ton of critical thinking opportunities going, possibly taking care of not only COVID patients, but med-surg patients. So tons of critical thinking. I would say one of the main specialties of 5 West is our teamwork, and that showed through even more with COVID because of, like I said, the amount of PPE that our staff do have to wear going in and out of those rooms. So tons of teamwork, great team morale, great support. Like I said, even going through COVID together, I didn't think it could get better, but it sure did. It was awesome to watch our team go through all those adversity, and they came out and did an outstanding job.
Thank you, Brandy. Marla, I have you up next for 4 and 5 lead.
Sure. Hello. I'm Marla Melgoza, the nurse manager for 4 and 5 lead. So 4 and 5 lead, we're a med-surg orthopedic floor. So I have 40 beds. It's unique because we kind of have both worlds. Specialty wise, we probably do about 40% orthos and 60% are med-surg patients. So you kind of have that acute care, med-surg level of care that come in maybe through the ED, or they're coming from the ICU once they get more stable. We have direct admits that come from all over different cities. So just a variety of diagnoses. Also just a variety of people that are independent versus dependent on our care. It's all adult population. And then we have our ortho patients. So these patients are kind of sometimes a breath of fresh air. So they're mostly healthy. It's planned. So they have tons of education prior to coming in. They know what's going to be happening. They know all the steps and when they're going to be discharged. Any more orthos come in, they get total knees and they're gone the next day, anywhere from 1 to 2 days. So they do really well. We have great surgeons and have good relationships with the ortho docs. So yeah, the patients are excited to be here and are glad to get their hips, knees, shoulders, whatever done that's been causing them pain for a long time. So it's nice to see them come in and leave and start their physical therapy. So it's just a great floor to learn. Any med-surg unit is just the perfect floor to start, especially as a new grad. But honestly, as a nurse with any experience, it's a great floor to stay too. I have nurses that have been a part of this unit for 40 plus years and are still on the unit, working those 12-hour night shifts, and they're amazing and are great resources. So love to have any of you.
Marla, thank you. So up next, I have Heidi Tani for the Oncology Med-Surg unit.
Hi, everybody. Like Renee said, my name's Heidi Tani. I manage, it's called Med-Surg Oncology, 8 Werner. It kind of has a myriad of names, but we are located just like Missy's unit in the Fred and Pamela Buffett Cancer Center in the Warner Cancer Hospital. We have the penthouse on the 8th floor. Our unit is really, the name is Med-Surg Oncology, and that truly is reflective of the types of patients. It's really a broad term, but we really see a wide variety of oncology patients. So Missy had talked a little bit about the liquid tumors, and we see more of those solid tumors. So think of your lung, colon, pancreatic, breast, any of those types of patients we would see. We do see them out of the OR. So post-op patients are a big portion of our oncology patients. So our goal with them is really to get them back to a baseline where they can go home safely. I think one of the great things about those patients is that they come with lots of drains and tubes. So as new nurses or as even experienced nurses, you always get to learn a variety of post-op cares, and they all come with various things. So that skill set is really, you get a really broad skill set with that. On the medical side of things, those patients typically, unlike Missy's patients, they're not coming in for their chemotherapy. A lot of our oncology patients are receiving their treatment outpatient. So when they come into the hospital, they're sick with something. So that could be, that they have pneumonia. I mean, we're in cold and flu season, which feels like it's been about 18 months now, but truly is a new one. And so we see a lot of patients that get infections over the winter, or maybe they aren't tolerating their treatment. We do a fair amount of end-of-life care, palliative care for our patients. I think one of the great things about our unit is that we do get to see our patients again. So we form those relationships, and even if they're only there for a short time, a lot of times they come back. So it's helpful for our staff to get to know our patients, and it's wonderful for our patients because they truly are some of the best patients you'll ever meet. When we have COVID patients in the hospital, we have some of Brandy's patients over on our unit. Temporarily, we take care of the bariatrics and the cystic fibrosis patients when they can't go to 5 West. So like everybody has said, med-surg gives you a wide variety of opportunities to learn, but I think one of the things that I love about our unit is because we have such a wide variety of patients, every day is a learning day. So it doesn't matter how much experience you have, there's constantly something new to learn. And I think Meg pointed it out too, that I think that sometimes there can be this misconception that med-surg patients aren't complex, and that's absolutely not true. And I think that all of us have those patients on our unit that the nurses play a huge role in figuring out what's going on and carrying out that plan of care and intervening appropriately, calling those RRTs when their patients are getting critical. And I think that it's really fun to see them on the back end when they're doing better, and you get to send them home. So it's kind of that best of both worlds. A great place to start your career, but also a great place to stay throughout your career.
Thank you, Heidi. I would like to open it up for questions, so our attendees can ask the group of managers we have here this evening anything that might be on your mind.
Hello, everybody. Thanks. This is really wonderful. I just have a general question about training programs. I know they're not the same across the board, of course, but like, what would be a typical training where, I would be shadowing somebody for your specific departments? Like, can you give me generalized timelines? Is it just because in my history of nursing it's been a little misleading at times where they'll say, oh, you're going to be training with someone for 3 months. And then 2 days in, they're like, we're short staffed, you're on your own. So I was just curious if you have a strict, like, this is what you're going to be trained on before you're left on your own. Thank you.
I can touch on that, and then please anybody add in. These are amazing. All of us work well. All of us work together, even though Melanie and I are at Bellevue, we are all peers and reach out to one another for advice and support. So please, everybody feel free to pipe in. But I think that there are some things that you can expect as fairly routine in our competence-based orientation that all of our nursing professional development specialists work to provide for all of our new graduates, RNs, and our experienced nurses. So there's some things that are standardized. Everybody begins orientation at our new colleague orientation, and there's certain things that happen that first week related to learning where you park, get your badge, learning about Nebraska medicine, our values, our culture. There's obviously modules and education that you have to do. Midweek at Bellevue, you come there, and then we take you from there. But what's really great is as you look at this group of managers, all of us have nursing professional development specialists, educators specific to our unit, but they are their own team as well. And they all collaborate and coordinate together. A standard med-surg orientation for a new graduate nurse would probably be around 8 weeks. Would everybody agree with that? 8 to 10 weeks. If you're an experienced nurse, I think it would just vary 6 to 8 weeks, depending on your experience level and what you've had. We meet with you during those times. We see how things are going, and we monitor that along the way. Obviously, there are units that have specialties. I think Missy, Heidi, Missy and Heidi have spoke to those things related to the cancer units. So obviously you would have specialty classes related to that. I'm gonna let anyone else kind of pipe in on what orientation seems to be for them too.
I can go. So yeah, just everything Meg said. Week 1 is going to be that new colleague orientation. On the special care unit, same thing. For our experienced nurses, we're looking at 8 weeks. If you come with experience, maybe 6 weeks, but maybe not. We'll keep you at the 8 weeks. You're learning, very different things. Our professional development specialist and myself meet with you weekly. Orientation, we do 3 out of the 8 weeks, Monday through Friday from 7 to 3:30. We do 8-hour shifts in an effort to build consistency and repetitiveness with certain skill sets. You might be here 5 days in a row and hang chemo 5 days in a row. Another positive of that is you really get to meet the team that you're working with. After those 3 weeks, then we switch it to the 12-hour shifts. We do 50% orientation on the day shift if you're a night shift hire, and then you end your orientation on the shift that you're hired into for 12-hour shifts. For both Heidi and I and any unit in the Warner Tower, we have an oncology nursing fellowship program. Also that all of our, whether you're a new grad or an experienced nurse, we put you through that fellowship. We don't start you in that till you've been here about 6 to 9 months though. But yeah, there's different, depending on the unit you're in, you're gonna have some different specialty courses that you'll take.
Yeah, we also offer a medical surgical fellowship too that are med surge. Me, Marla, Cassie would be the other one, 6-7 lead that we have our nurses do a medical surgical fellowship. On the COVID side, I have hired a couple experienced nurses last summer, and they did just with the PPE practices and just getting more practice with making sure you're staying safe with your PPE. It did take 6 to 7 weeks of orientation, and we were totally fine with that. Typically for us as well, we just started doing the 5 days a week for the first 2 weeks. We have our first 2 nurses doing that currently right now, and it's going very, very, very well. So we're expecting 6 to 7 weeks for them. It just depends. Like I said, with the COVID side is a little bit different, but yeah, very, very similar to the rest of the units for 5 West.
One other thing that all of our new nurses receive is a competency-based orientation packet that you'll be working off of. So you will work with your preceptor to complete that, and just it highlights each area and things that you need to be trained on. So kind of a guide to your orientation, and just make sure you don't miss out on anything.
Any other questions for our managers here?
I just have one quick question. It's Catherine here. Are most of your open positions, they going to be night positions?
At Bellevue, ours are currently night positions. We put any nurses, and we kind of go on a first come, first serve basis on a list to come to days. And we actually have been able to fairly readily move people to our day shift. But for us right now, our open positions are night shift.
Okay, thank you.
Mm-hmm.
Ours is the same exact as Meg. We've got a list of current night shift, first come, first serve basis. I keep a list and move them up. So I typically hire into the night shift, but there's been a time in the past where nobody wanted to move up. So I have hired staff into a day position. Just depends.
Sure.
Yeah, I have both.
I do as well on 5 West.
Yeah.
A lot of them are new, if you're a newer grad nurse, though a lot of ours actually like to start on nights. That's very, very typical just because it's a little, you know, you're not having to deal with discharge and admit back and forth. You're able to kind of think and process and look at doctor's notes and just get a little bit better foundation on that night shift. So you don't have so many other distractions throughout the day, and you can just be a nurse, be with your patient, and just learn about their anatomy and, you know, everything going on with their, you know, their illnesses and the processes of those things.
Any other questions? I know we've covered a lot of the questions. I think sometimes what is very interesting for other candidates to hear is a little bit about maybe the manager's journey and how did you decide to be a nurse? I think that's information that can be very relatable as we visit with individuals considering Nebraska medicine or at that point where they're about ready to start a nursing career. So I am just going to let any of you jump in that are willing to share.
I'll share. You guys always know I'll talk. So I have been a nurse at Nebraska Medicine for 15 years, all on 5 West. I'm one of those, if it's not broken, don't fix it. I started here as a brand new graduate nurse. And one of the main reasons I actually chose Nebraska Medicine to work at was we are a shared governance structure hospital. And what that pretty much means is that nurses have a voice, and our upper leadership listen to those voices of the nurse. So all those ideas and everything that that you have, it comes from the bottom up. It goes up. A lot of places it's the top down. All the ideas and stuff come from the upper leadership. It's the nurses at the bedside practicing every day. That's where the ideas come from. And so that was one of the main reasons I wanted to work in Nebraska Medicine.
Anyone
Nursing
else?
was a second career for me. I'm sure glad I chose it though. I've been on the special care unit the whole time. I started as a student in my preceptorship, and just opportunities continued to present themselves. I worked nights for 11 years. I worked as a staff nurse, a lead nurse, an associate nurse manager, and then now the manager. I tell all of my interview candidates, if you're willing to step up and, you know, be a part of committees and whatnot, step outside of your comfort zone, opportunities will.
Welcome back, everyone.